Hormonal contraceptives and cardiovascular risk. Hormonal contraceptives are a popular method for women to effectively manage birth control. However, some types of contraceptives can increase the risk of cardiovascular issues, particularly heart attacks and strokes. This is especially crucial for women with existing risk factors such as smoking, hypertension, or lipid disorders. Combined hormonal contraceptives, CHCs, and cardiovascular risk. Combined hormonal contraceptives, CHCs, contain both estrogen and progestin and are available in the form of pills, patches, or vaginal rings. While effective in preventing pregnancy, CHCs can increase the risk of blood clots, leading to arterial blockages and a higher likelihood of heart attacks and strokes. A study conducted on over 2 million women in Denmark found that those using CHCs had double the risk of heart attacks compared to non-users. This translates to approximately 1 additional case of heart attack per 10,000 women using CHCs annually. Hormonal vaginal ring and higher risk. Not only oral contraceptives but other hormonal birth control methods also impact cardiovascular health. The vaginal ring, which contains estrogen and progestin, has been shown to increase the risk of heart attacks by up to 3.8 times compared to non-users. This occurs because estrogen stimulates the production of clotting factors, raising the likelihood of thrombosis. Progestin-only contraceptives, a safer option. Compared to CHCs, progestin-only contraceptives have a lower impact on cardiovascular health. These methods include pills, implants, injectable contraceptives, and hormonal intrauterine devices, IUDs. Among them, the progestin-only IUD is considered the safest as it does not increase the risk of heart attacks or strokes. Conclusion. Women with a history of cardiovascular disease or high risk factors should consult a doctor before using hormonal contraceptives. Choosing the right contraceptive method not only ensures effective birth control but also protects long-term heart health. Non-steroidal anti-inflammatory drugs, NSAIDs, and cardiovascular risk. Non-steroidal anti-inflammatory drugs, NSAIDs, are a widely used class of medications for pain relief, fever reduction, and inflammation control. Common NSAIDs include ibuprofen, naproxen, and diclofenac. While effective, NSAID use can increase the risk of cardiovascular problems, particularly heart attacks and strokes. NSAIDs and the risk of heart attacks and strokes. Studies have shown that NSAIDs can impact the cardiovascular system by disrupting the balance between vasodilation and vasoconstriction, increasing blood pressure, and impairing platelet function, leading to clot formation. This can elevate the risk of heart attacks and strokes even in individuals without prior cardiovascular conditions. Notably, this risk can emerge within just the first few weeks of NSAID use. Moreover, high doses or prolonged use significantly amplify cardiovascular risks. Comparing the risks of different NSAIDs. Not all NSAIDs carry the same level of cardiovascular risk. Some have a more pronounced negative impact on heart health. Diclofenac. Among NSAIDs, diclofenac poses the highest cardiovascular risk. Studies indicate a significant increase in heart attacks and strokes, especially in individuals with a history of heart disease or high blood pressure. Ibuprofen, a commonly used NSAID, ibuprofen can increase cardiovascular risk when taken in high doses and over long periods. However, at low doses and short durations, its risk is lower than diclofenac. Naproxen. Considered a safer option, naproxen has been shown to have a lower risk of heart attacks and strokes compared to diclofenac and ibuprofen. Guidelines for NSAID use. Due to the associated cardiovascular risks, individuals with heart disease, hypertension, or high cardiovascular risk should limit NSAID use, particularly diclofenac. If long-term pain relief is necessary, consulting a doctor for safer alternatives like naproxen or other options is advisable. Thiazolidinedione diabetes drugs, Rosiglitazone, and cardiovascular risk. Thiazolidinediones, TZDs, are a class of medications used to treat type 2 diabetes by increasing the body's sensitivity to insulin, thereby improving blood sugar control. Among these, Rosiglitazone is one of the most commonly prescribed drugs. However, despite its glucose-lowering benefits, Rosiglitazone carries serious cardiovascular risks, particularly heart failure and myocardial infarction. Rosiglitazone and its impact on the cardiovascular system. Rosiglitazone works by activating PPAR gamma receptors, which regulate glucose and lipid metabolism in the body. While effective in improving insulin sensitivity, the drug has concerning side effects, including fluid retention and imbalance. This can increase pressure on the heart, leading to a higher risk of congestive heart failure, especially in individuals with pre-existing heart conditions. Effects on blood lipids. Rosiglitazone may alter lipid profiles by raising LDL, bad cholesterol, thereby increasing the risk of cardiovascular disease. Increased risk of heart attacks. Numerous studies have examined the link between Rosiglitazone and cardiovascular disease. A pivotal study published in the New England Journal of Medicine found that Rosiglitazone use could raise the risk of heart attacks by 43%. While some studies have not shown a significant increase in cardiovascular-related mortality, the risk of heart failure associated with this drug remains well documented. Weighing benefits and risks. Due to its potential cardiovascular risks, Rosiglitazone should be prescribed with caution. For patients with a history of heart disease, heart failure, or high cardiovascular risk, doctors often opt for safer diabetes medications, such as metformin or SGLT2 inhibitors. Guidelines for using Rosiglitazone. Monitor for signs of fluid retention, shortness of breath, or leg swelling, as these may indicate heart failure. Regular lipid testing is recommended to assess cardiovascular risk. Consult a doctor about alternative diabetes medications if cardiovascular risk is high. While Rosiglitazone can be effective in blood sugar management, it should be used with caution to avoid unwanted cardiovascular complications. Antidepressants, TCAs and SSRIs, and cardiovascular risk. Antidepressants play a crucial role in treating depression and anxiety disorders. Two commonly used classes are tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs. While effective in improving mood, these medications can impact the cardiovascular system in different ways, requiring careful consideration, especially for patients with heart conditions. TCAs and the risk of arrhythmias. TCAs, such as amitriptyline and nortriptyline, are among the oldest antidepressants. They work by inhibiting the reuptake of serotonin and norepinephrine, helping to alleviate depressive symptoms. However, TCAs also have significant effects on the cardiovascular system, including inducing arrhythmias. TCAs can prolong PR, QRS, and QT intervals on an electrocardiogram, ECG, increasing the risk of severe arrhythmias such as ventricular tachycardia or fibrillation. Causing orthostatic hypotension. Due to their effects on alpha-adrenergic receptors, TCAs can lead to a sudden drop in blood pressure upon standing, increasing the risk of dizziness and falls, particularly in older adults. Increasing heart rate. The anticholinergic properties of TCAs can lead to an elevated heart rate, placing additional strain on the heart, especially in patients with pre-existing cardiovascular disease. Given these risks, TCAs are generally not the preferred choice for patients with a history of heart disease. SSRIs, a safer option with some considerations. SSRIs, such as fluoxetine and citalopram, are widely prescribed due to their improved safety profile compared to TCAs. They work by selectively inhibiting serotonin reuptake, maintaining chemical balance in the brain without significant cardiovascular effects. However, some concerns remain. QT interval prolongation. Certain SSRIs, particularly citalopram, can lengthen the QT interval on an ECG, increasing the risk of torsades de pointes, a rare but potentially fatal arrhythmia. Citalopram dosage limits. To minimize cardiovascular risk, the FDA recommends a maximum daily dose of 40 mg for adults and 20 mg for older adults or those with high cardiovascular risk. Considerations when prescribing antidepressants. TCAs should only be used when safer alternatives are unavailable, especially for patients with heart disease. SSRIs, particularly fluoxetine or sertraline, are generally preferred for patients at cardiovascular risk. ECG monitoring is advised for patients taking medications that may prolong the QT interval, especially citalopram. Patients with a history of abnormal heart rhythms or low blood pressure should consult a doctor before starting antidepressants. While antidepressants are effective in managing depression, their potential cardiovascular effects necessitate careful use and close monitoring. Pseudoephedrine as a nasal decongestant and cardiovascular risk. Pseudoephedrine is a common active ingredient found in many over-the-counter (OTC) medications used to relieve nasal congestion caused by colds, allergies, or sinusitis. While effective in reducing nasal blockage, pseudoephedrine can significantly impact the cardiovascular system, especially in individuals with heart disease or high blood pressure. Mechanism of action of pseudoephedrine. Pseudoephedrine works by stimulating alpha-adrenergic receptors, causing blood vessels in the nasal mucosa to constrict. This helps reduce swelling and open up the airways. However, this vasoconstrictive effect is not limited to the nasal passages. It also affects the circulatory system, potentially leading to increased blood pressure and heart rate. Cardiovascular risks of pseudoephedrine. Increased blood pressure. Due to its vasoconstrictive properties, pseudoephedrine can elevate blood pressure, posing a serious risk for individuals with pre-existing hypertension or heart disease. Tachycardia. Increased heart rate. This drug can stimulate the sympathetic nervous system, leading to a faster heart rate, which can put additional strain on the heart, particularly in those with existing cardiovascular conditions. Risk of heart attack. In patients with coronary artery disease or a history of myocardial infarction, pseudoephedrine may trigger arterial spasms, reducing blood flow to the heart and increasing the likelihood of angina or heart attack. Arrhythmias. Some individuals may experience irregular heart rhythms when using pseudoephedrine, especially at high doses or with prolonged use. Dangerous drug interactions. Pseudoephedrine can interact with certain medications, increasing the risk of severe side effects. MAOIs, monoamine oxidase inhibitors. Combining pseudoephedrine with MAOIs can lead to a dangerous spike in blood pressure, potentially causing a hypertensive crisis. Beta blockers. These medications are commonly used to treat hypertension and heart disease, but when taken with pseudoephedrine, their blood pressure lowering effects may be diminished, leading to further elevation in blood pressure. Precautions when using pseudoephedrine. Individuals with a history of heart disease, high blood pressure, or arrhythmias should consult a doctor before using pseudoephedrine. Avoid prolonged use or exceeding recommended dosages to minimize cardiovascular risks. Monitor blood pressure and heart rate while using the medication, especially in high-risk individuals. Consider safer nasal decongestion alternatives, such as saline nasal sprays. While pseudoephedrine can effectively relieve nasal congestion, its use should be approached with caution to prevent adverse cardiovascular effects, particularly in individuals at higher risk.